Hello everyone and welcome to Blood and Hematology YouTube channel. Diagnostic criteria and blood and bone marrow morphology of essential thrombocythemia are discussed in this video. Essential thrombocythemia is a relatively indolent and often asymptomatic clonal myeloproliferative neoplasm that involves predominantly megakaryocytic lineage, characterized primarily by a sustained thrombocytosis, megakaryocytosis, and minimal to absent bone marrow fibrosis. Essential thrombocythemia may be an incidental finding, or patients may present with venous or arterial thrombosis, bleeding, or symptoms of a hypermetabolic state. Diagnosis of essential thrombocythemia should be based on a composite assessment of clinical, morphological, and laboratory features. Diagnosis requires meeting all four major criteria, or the first three major and one minor criteria. The WHO diagnostic criteria for essential thrombocythemia are as follows. Major diagnostic criteria for essential thrombocythemia include sustained thrombocytosis, bone marrow megakaryocyte proliferation with mature cytology, hyperlobulated nuclei, no significant increase or left shift in neutrophil granulopoiesis or erythropoiesis, and no relevant bone marrow fibrosis. Diagnostic WHO criteria for BCR-ABL1 positive chronic myeloid leukemia, polycythemia vera, primary myelofibrosis, myelodysplastic syndrome, or other myeloid neoplasms are not met. Demonstration of Janus kinase 2 or calreticulin or myeloproliferative leukemia virus oncogene mutation. Minor criteria include presence of a clonal marker, and no evidence of reactive thrombocytosis. Peripheral blood shows moderate to marked thrombocytosis. The platelets often exhibit anisocytosis, from tiny to giant platelets, atypical forms, hypergranular or agranular platelets, bizarre shapes, and pseudopods. Commonly platelets are present in clusters and tend to accumulate near the thin edge of the blood film. Total white blood cell count is normal or slightly increased, and typically shows normal maturation and distribution and a normal leukocyte differential count. Immature granulocytes or leukoerythroblastosis are uncommon at diagnosis. Hemoglobin and hematocrit values are slightly decreased, and erythrocytes are normocytic and normochromic. If there have been episodes of hemorrhage, mild anemia may be present. Bone marrow examination is essential in making the diagnosis of ET, and allows its distinction from other myeloproliferative neoplasms, and from reactive causes of thrombocytosis. In essential thrombocythemia, the cellularity of the bone marrow is variable, but is often normal or only modestly increased. The abnormalities are restricted to the megakaryocytes, which are dispersed throughout the marrow and include frequent large forms with abundant cytoplasm and multilobulated nuclei. In a few patients, reticulin fibers may be increased. Usually, erythroid and granulocytic proliferations are normal, and there are no dyserythropoiesis and dysgranulopoiesis. CBC results and peripheral blood film of a 70-year-old patient with essential thrombocythemia showing marked thrombocytosis. Peripheral blood film showing thrombocytosis, platelet clusters and platelet anisocytosis ranging from very small to large platelets. Peripheral blood films showing platelet anisocytosis ranging from very small to large platelets. Peripheral blood film showing large and giant platelets. CBC results and peripheral blood film of a 67-year-old patient with essential thrombocythemia and Janus kinase 2 mutation showing thrombocytosis and increased mean platelet volume. Peripheral blood films showing giant platelets with pseudopods. CBC results and peripheral blood film of a 68-year-old patient with essential thrombocythemia showing marked thrombocytosis. Peripheral blood films showing marked thrombocytosis and hypergranular platelets. Peripheral blood films showing hypergranular platelets. Bone marrow films of a patient with essential thrombocythemia showing atypical and quite large megakaryocytes with abundant cytoplasm and multilobulated nuclei. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.